Hi, my name is Johanna Bendel, and I'm a physician who directs the GI Oncology Cancer Research Program at the Sarah Cannon Research Institute. I'm here today to tell you, for the treatment of metastatic colorectal cancer, there are so many new treatments that are coming for patients. We have whole new ranges of hope for people. What we're really focusing on now in terms of treatment of metastatic colorectal cancer is the concept of targeted therapy. We're starting to get smarter about learning what makes a cancer tick and what specific pathways within the cancer cell help it grow. We also have drugs that specifically target those pathways now. So instead of turning off your cancer with chemotherapy, we can turn off your cancer much more precisely with targeted therapy. We've already seen examples of targeted therapy work for patients with metastatic colorectal cancer. These include agents that target the VEGF, or vascular endothelial growth factor pathway. You might also hear it as anti-angiogenic therapy. This blocks tumor blood vessel growth. We also have agents that target the epidermal growth factor receptor pathway, or EGFR pathway. And this targets exactly how the tumors grow. We have new agents that are out there, one of which is in clinical trial right now. It's an agent that targets something called the c-Met pathway. Patients with colorectal cancer who have high levels of a receptor which sits on the outside of their cancer cells called c-Met tend to have a worse prognosis or do worse than the average patient with advanced colorectal cancer. For this reason, we're looking at targeting this pathway to try to help not only those patients who have a high level of c-Met on their colorectal cancer cells do better, but all patients with colorectal cancer do better. We've seen some very promising initial data using drugs that target the c-Met pathway in patients with non-small cell lung cancer, liver cancer, and even gastric cancer. We're so excited to try to bring agents that target this pathway now to patients with advanced colorectal cancer. What this trial is doing is it's having patients receive standard chemotherapy for colorectal cancer, and then patients receive either the agent that blocks the c-Met pathway or a placebo. We're so excited to be able to offer this chance to our patients, and we think that the addition of this agent will increase side effects very minimally. Please talk to your doctor about whether or not they might offer this clinical trial for you, or if they have any other clinical trial options that might be available. We all know that the NCCN guidelines say that the best treatment of any cancer patient is a clinical trial. And us together doing clinical trials are going to help all patients with cancer and eventually find the cure for this awful disease. Thank you.